Hello everyone, I'm Dr. Angela Mattke, and you're watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at Mayo Clinic Children's Center. Twice per month, I host a show where we talk about pediatric health topics and take and answer your questions live. Today, we're talking about congenital hand differences and hand injuries in children. Joining us for this discussion is Dr. Stephen Moran, a talented hand surgeon at Mayo Clinic with expertise in the treatment of congenital hand differences. Dr. Moran is the former chair of plastic surgery, the current director of the American Board of Plastic Surgery, a professor of plastic surgery and orthopedic surgery, and the surgical director of the hand transplant program at Mayo Clinic. It's going to be a great discussion today, so please send in your questions under the Facebook Live video feed, and we will try our best to review them during the live broadcast today. And just a note to our viewers, some of the images that we will be showing today may be difficult to look at. So, Dr. Moran, thank you so much for joining us here today.
Thanks for having me, Angie.
And so, as we start, I think we should broadly speak and kind of understand what do we define as congenital hand differences or congenital hand deformities?
Well, this is any really difference between one hand and another in a child. In some cases, it'll be in both hands, but hand differences can be caused by a variety of things. Historically, they were caused by medications, most of which we know about now.
Right.
But now in this day and age, most of them are sporadic. They just happen as of consequence. However, some can be inherited and passed on, and some can be due to positional problems with the baby during development.
Okay. So we're going to talk about some different types of differences that we may see. What about a baby who may be born without a finger or actually without a hand? What are some of the causes of that?
Well, there are several causes of that, and that's probably the most common situation that we see when parents bring their child in. One of the ones that we see is something called brachydactyly, and we do have a picture for the parents watching at home. And this is a situation where the child may have very short fingers, where the nails are still intact, and this is usually due to a situation where a blood vessel didn't form properly during development. The next most common one is something called congenital constriction band or amniotic band syndrome. And this is usually something that develops when the membranes around the baby rupture prematurely during development. And pieces of that membrane can wrap around the hand or the finger or the leg and cause bands, as you see in these images here. That can sometimes cause amputations of the finger and cause the baby to be born with problems both in the hands and in the feet.
Okay.
And then the last condition that we can see is just underdevelopment of fingers or thumb. In this picture here, we have kind of a spectrum of differences that we can see in the thumb, ranging from a very underdeveloped thumb on the left-hand side to an absence of the thumb that you can see in the middle there with the two fingers grown together. This situation is a little bit more complicated than the others that you saw, and these are usually the types of differences that we usually want to do a little bit more of a medical workup on the baby to make sure we're not missing something.
Okay. Things like an underlying genetic disorder, is that what you're referring to?
That's right.
Okay.
Most babies that are born with hand differences, we usually recommend that they have had a very thorough heart and kidney screen.
Okay.
And the reason for that is that during development, the hands develop about the same time as the heart or the kidney. So something that's caused a developmental difference in the hand most likely has affected those other organs as well.
Okay. Another difference that can be seen is being born with maybe an extra finger. Can you talk a little bit more about that?
Yeah, now that's a benefit if you're going to be a great musician, but,
Right.
but for most parents, they do choose to have those removed. And I think we have an example also here. These can occur either on the thumb side or on the small finger side. It's most common to occur on the small finger side. And historically, many of these have been tied off, like you'd tie off an umbilical cord in the neonatal nursery. We don't recommend doing that anymore because those can lead to painful scars in the children, and we usually recommend doing this on an elective basis once the baby returns home.
Okay. Well, that does bring up a question. So surgical interventions for some of these procedures are going to be recommended. Is it safe for an infant to undergo surgery at that age? And is there any kind of planning that's done before?
Yeah, that's a great question. We obviously, depending on the severity of the difference, we sometimes recommend surgery at different time points. We usually would like to have most of these differences taken care of before the child is usually 3 or 4, or the time that they're going to preschool. Some differences, such as differences in the thumbs, are taken care of before the age of 1, just so the child can learn how to pinch and grip with a new hand as they're learning other developmental tasks.
Okay. Now, going back to talk about differences in kind of hand development, can you talk a little bit more about those? I know you mentioned that sometimes these may be associated with some underlying genetic disorders, but I think we have a nice picture of the longitudinal differences.
That's right. So as the difference gets to be more severe, and if we can go to the next slide, and this is difficult to look at for many parents, but this just points to the challenges that many parents and kids have to deal with. When we're dealing with problems that involve not just the hand, but as you see in these pictures here, also the forearm, these are some of the differences that cause us to be concerned about other conditions. The image that you have on the far left side there is a condition where the radius bone in the forearm fails to develop. And this can often be associated with problems in the spine, in the esophagus, and heart and kidneys as well.
So, for a parent that maybe was born with one of these congenital hand differences, a question that you may get sometimes is it something that they can pass on to their child?
Yeah, that's another question that we often get. There's a couple things that we know can be passed on in a congenital manner, or autosomal dominant inheritance pattern is something that you'll also hear. But those tend to be webbed fingers and extra fingers. Some of the other conditions can be picked up in parents if they opt to have genetic testing, and then a geneticist can inform the parents what the real statistical chances are of passing on that problem.
Okay. Now, some of these hand differences or finger differences, can these be detected in ultrasound prenatally?
Yes, and we've noticed that more and more, probably for the past decade, as our technology has gotten better. Many parents will come to see me before they even deliver the baby, and we can talk to them about what the plan will be after the baby's born. And I think that really gives parents a sense of calm, because as I've said, many of these conditions can be taken care of without much problem for the parents or the child. And for example, extra fingers can be removed, and the child will never even remember that they had the finger if taken care of early enough.
Right. Who should be seeing these children who have congenital hand differences or congenital finger differences?
I think it's important for the children to be seen at a center where there's a team taking care of them. So we really rely on you guys to help us so much with these kids, but not just great pediatricians, but pediatric anesthesiologists, hand surgeons that are specialized in pediatric hand problems, but also therapists and prosthetists that are used to working with kids. That's really important.
Absolutely. Now, you mentioned webbing of the fingers as another hand difference. Can you talk a little bit more about that?
Yes, so this is called Syndactyly, and we have a slide here. This can come in a variety of different presentations, from just partial webbing, as you see in the top left, to complete connection of all the fingers and the nails, as you see in the top right. This is one of the more common conditions that we see, and this is usually taken care of before the child's 2 years of age. And the fingers are simply separated surgically, and then small amounts of skin grafts are placed on the inside aspect of the fingers to help replace the missing skin.
Where does the skin grafts come from when you do this?
Yes, so in kids, fortunately, most of them are pretty chubby, and we take a little pinch of skin from their groin area. That's a scar that's hidden very well. They usually never see it. But there are other options if that's not possible. Okay.
Are some of the surgeries that you do, not just for syndactyly, but for other conditions, do they require multiple surgeries, or does it depend on the situation?
Yeah, that's another very good question. So when you have multiple fingers involved, many times we will do 2 or 3 fingers at once. And sometimes we'll do 2 hands at once, but many times we do have to stage the procedures depending on the severity of the deformity.
Okay. I'm sure a concern that parents have with this is, how is pain managed after these surgeries?
Yes.
And is there certain things that can be done to kind of help prevent pain from getting worse?
Yeah, that's another great question. We really don't want the child to experience any discomfort. I rely on using long-acting numbing medication like you'd get at the dentist's office, lidocaine or Marcaine, and that usually allows for very good pain relief for up to 14 hours. The child then is usually put in a cast because we can't rely on them to be careful, and then that really keeps the hand still. The cast in most of these kids will come all the way up to the armpit because most of them are little Houdinis and will sneak out of it.
Right, absolutely.
But we've been very fortunate that most of these surgeries can be managed usually with this Tylenol or children's Advil, and in some cases they require narcotics, but that's very infrequent.
Okay. What's the recovery look like for these surgeries? How many months until they're kind of back to being able to use it normally?
Yeah, the kids are usually very quick to heal, and for all of our surgeries, we usually put them in a cast for 4 weeks. That's kind of just our standard for most things that require bone work or skin grafting, and that just protects the child from getting it wet, from putting it in the dog's mouth, from doing a variety of things. And so that when that cast does come off in 4 weeks, it's totally healed and ready to go. Most kids also are very good at doing their own therapy and start playing very quickly.
Okay. Is occupational therapy something that you guys do incorporate in sometimes?
Yes, there are certain conditions, those that involve the muscles and the tendons, where we have tight muscles and tendons, and those can involve a lot of stretching and splinting sometimes before surgery and then after surgery.
Okay. Is Botox ever something that you use as part of these surgeries?
Yeah, that's another great question. For a certain spectrum of children's problems, particularly cerebral palsy or spasticity, we do use Botox as a means of seeing how the muscles and the tendons are going to respond before we do surgery on the child.
Okay. So moving on to another kind of condition. So sometimes infants can be born and parents will say to me that, their thumb won't bend very well. What is that condition and what can you do for it?
That's, and I think we have a slide of that as well. That's one of the more common conditions that we see, and that's trigger thumb.
Okay.
And it's similar to an adult in that the thumb gets stuck in a bent position. It's very painful for the child to open the thumb. And we're not sure exactly what causes this. Some people think it's due to thumb sucking, some due to the trauma from crawling and falling as they learn how to walk. But this condition can usually be treated by stretching and splinting. And in some cases, we do a very small operation just to release the tight band around the thumb, and that allows the thumb to extend.
So is the infantile trigger thumb, is that the same as what you would see in adults, that sort of trigger thumb diagnosis?
It is a similar mechanism. We are not entirely sure of what causes it. The children tend to develop a very thick swelling around the tendon, and that seems to be the cause of the problem.
Okay. So there's another type of congenital group of congenital differences that can sometimes not present in infancy or in childhood, but maybe present later. What are some of those? Can you talk a little bit about them?
Yeah, there's a group of congenital and genetic-based problems where the bones may not grow properly. And this might not be picked up in the child until they reach their early teens or adolescence. One of the conditions that we see is something called the Madeleine's deformity, and we have an image of this on the screen. I think it's important for parents to understand that if their child, as they get into high school, does start to complain of wrist pain or the inability to do something during growth spurts, that's maybe the time to have your child seen by your pediatrician or by a hand specialist. These conditions can be treated. Some can be splinted, but some of them do require surgery to relieve pain and prevent long-term arthritis.
Okay. And what would be the cause of especially the Madeleine's deformity?
Well, we know now that the Madeleine's deformity is caused by an anomaly on a group of genes called the shock genes, and this can be tested for, and it just causes the bones to grow in a little bit of an abnormal fashion, but that can lead to pain as they get older.
Does it just cause problems kind of in the wrist, or can it cause problems in other areas
It can.
as well?
We can see problems in the knees and the ankles as well.
Okay. Sounds good. All right, so we've talked about a lot of congenital differences in hands and fingers, but another area that you see are injuries to hands and fingers of children. Probably one of the more common things is a fracture to the hand or fingers. What would be some signs and symptoms that parents should look for that their child may have had a fracture?
Yeah, that can be very hard when you have a little kid.
Right, especially young ones, right?
Who can't really tell you what's going on. But I think obviously deformity, any laceration that occurred from a crush or getting the finger caught in a door, which we all see in our kids, those are the mechanisms that really cause us to be concerned. But I think if your child continues to complain of pain after about 5 hours after the injury, or if they are really protecting the hand and not using it, those are the types of things that you have to be concerned. There may be something going on, and it's worth bringing the child in to be evaluated. Most kids won't let you, but if you press and they have what we call point tenderness or tenderness right on the bone, that is usually a very positive sign that there's something going on underneath.
Okay. What are some of the most common fractures that you see in the hands of children?
I think probably the most common fractures that we see are of the forearms when kids fall, and those do usually produce a fair bit of deformity that we can see. But they can cause very little, and the kid may just complain of persistent pain or not be able to use the hand for sports. But the other ones that we see very frequently are jammed fingers and fingers that have been caught in the car door or in the closet. And we have to be careful about these. Some of these can be very close to the joint. Some of them can go into the nail bed, and these are all things that should be evaluated by the pediatrician.
Yeah, and then I end up calling you on the
Yes.
phone when there's especially an open fracture of the fingernail bed and stuff, because that can be more concerning for infection, right?
Yes, and those can be missed. Sometimes when the kids fracture up by the tip of the finger when it gets caught in a car door, the nail can be pulled out from underneath the skin, and it can hide a fracture underneath. So we do want to be very careful in getting x-rays on those children to make sure that we don't miss anything.
Absolutely. So do you treat fractures of the hand and fingers in children different than you would an adult because of their growth plates, or is it similar?
Yes, that's another very good question. Fortunately, again, most kids will heal very quickly, and very few of the fractures that occur in the hand or the wrist need to be treated with surgery. But what they do need to be is immobilized and placed into a cast. Unlike an adult patient where these fractures would usually require surgery to put in plates or screws, kids can usually be close reduced. What that means is just with a little pain medication and sedation, we can put the bones back in the right position and then put them in a good fitting cast, and that'll allow them to heal.
Okay. How quickly do these fractures heal? Is it 2-3 weeks, or can it be longer, like 4 weeks or more?
Yeah, usually about 3 to 4 weeks we can get healing in forearm fractures, certainly, and in some of the wrist and finger fractures as well.
Okay. So apart from fractures, are there any other type of injuries or sport-specific injuries that you tend to see frequently in your office?
Yeah, and around this time of the year, we see a lot of them with basketball season, a lot of jammed fingers and dislocated fingers. And those, again, are usually things that we don't need to do much, but just do some therapy for. But I think it is important. Many kids will neglect them because they don't want to be taken out of sports. But I do think it's worth, if your child is having a lot of swelling, if the finger is deformed or angulated, those are something to at least bring the child in to see the doctor to make sure that nothing's broken. And then many times they just can be managed with splinting or buddy taping.
When you say jammed finger, what is usually actually happening in those situations?
Yeah, so in those cases, the basketball usually strikes the end of the finger and causes the joint to partially dislocate. In some cases, in severe cases, the finger may totally dislocate. Those need to be reduced, obviously put back into place, but they'll usually suffer a small, what we call avulsion, or a little piece of the bone will rip off, a bone fleck, sometimes what it's seen on x-ray. But that is definitely a sign that there's been an injury to the joint, and that's when you need to be careful.
A lot of times, I was a basketball player, people would just relocate them themselves. Is that something that you would recommend, or would you recommend they be seen prior to doing that?
Yes, I remember my coach spit on mine and put me back in the game. So we want to be careful about that. I think if they go neglected, the worst thing is that they can be re-injured.
Right.
And that's when we can really have problems with injuring the cartilage and the growth center, as you were talking about, which can lead to problems down the road. Okay.
Is there anything that can be done to avoid fractures developing in children?
Yeah, and now's another good time to talk about that too. For example, snowboarding. My own child, or skateboarding, has suffered a couple fractures. We now know that, and there's very good evidence to suggest that wrist braces, obviously wearing a helmet, in other supports can prevent the child from injuring the wrist. And because, as we said, the forearm and wrist are the most commonly fractured, I think that for those types of activities, that's a very good idea.
Snowboarding, skateboarding,
skating,
and skiing, or not? Is there
skiing, they have the pole in hand, so it hasn't been shown as much, but certainly with snowboarding.
Okay. Fantastic. So another thing that you probably tend to see a lot is overuse injuries, especially overuse injuries in the wrist. Certain sports like gymnastics may put people at higher risk. What other sports are concerning for overuse injuries in the wrist?
And I think that's a problem we see across the spectrum now. So kids are doing the same sport 3 seasons, and they get very little rest. So we are seeing a little bit of a rise in carpal tunnel syndrome in kids. We used to not see that only in adults. But injuries of the thumb and the ligaments of the wrist, the best thing to do is if the child can take a break 1 season from some sports, that's always a benefit. I think stretching and exercise, as they do offer here, to help build up the muscles to protect the wrist from those types of injuries.
Absolutely, and athletes need to speak up when they're injured instead of continuing to practice or compete under those circumstances, because that may ultimately set them back longer.
That's exactly right.
Yeah, and I know it's hard to do. I'm sure talking about myself probably 20 years ago wouldn't have been one of the people that would have spoken up that easily. But
yeah, I think the parents have to be aware. I mean, you're really doing your kid a disservice by not listening to their complaints or watching them. If they're not playing the way they used to, if they're not using their hand or their wrist the way they were, ask them about it. And if it is bothering them, it's worth taking them in.
Absolutely. So we've talked about a lot of things today. We've talked about the congenital hand differences. We talked about injuries, sports injuries, and other fractures in children. If families wanted to get in touch with you, if one of their children was diagnosed with a congenital hand difference or a finger prenatally, and they wanted to see you, how would they contact you?
Well, they have a couple options. They can certainly call our office here at Mayo Clinic. We also have a link through the Ask Mayo Experts where you can get information on the more commonly seen hand differences. But I think the best thing is they can work through their pediatrician or just call us directly here at the clinic. And we usually can get kids in pretty quickly. And as I said, for those parents that have been diagnosed before they have their baby, we're also happy to see them anytime.
Okay. Any advice for families as they go through the process when a child has been born with a congenital hand difference?
Yeah, I think it's, fortunately we have social media, and there are a lot of support groups out there, and I think it's very common to assume the worst. But we have true success stories of kids going on and competing at incredibly high levels in sports, being professional musicians. So the things that can be achieved now with the surgery and with different types of prosthetics are really amazing. And these support groups now for families can show parents what's possible.
Fantastic. Thank you so much for joining us today, Steve. This was wonderful.
Yeah, thank you.
Yeah. Thank you, everyone who watched and sent in questions. You can catch the next Ask the Mayo Mom Facebook Live, which will be on March 28th at 11 a.m. Central Standard Time. We will be discussing learning disorders in children and learning problems, so please join us then. Thank you, everyone who watched, and have a wonderful day.